Access to quality healthcare continues to be an obstacle in rural communities where people must travel much farther for healthcare than those in suburban and urban regions. As more hospitals close across the U.S., access to healthcare in rural communities may continue to narrow.
In rural communities, oftentimes people lack access to quality healthcare simply because of transportation issues. There's oftentimes not a public transportation system. Patients have to come from miles and miles away to receive the care that they need, and they simply have a difficult time finding the means to be able to make it to their appointments to make sure they receive the healthcare that they need. One of the main challenges to the healthcare sector right now relates to funding. We're constantly being asked to do more with less. And with a lack of funding, it makes it more and more difficult to be able to reach the people that are in our community that need access to healthcare.
To advance rural health and wellness, this sector must work to ensure that all individuals have access to affordable and equitable health.
The modern advances in technology, whether it's information technology or image recognition or distant access for patients to healthcare, and particularly delivery of healthcare, is nothing short of astonishing, really.
So patients have the tools to take control of their healthcare and seek treatment, medical advice, and education, and it opens the doors to better and more comprehensive medical experience. Patients can be more interactive with their healthcare team and do it on their time and how it seems to fit them best.
As technology continues to impact every aspect of our daily lives, in the healthcare sector, it's helping to support instant communication and is reducing the reliance on urban-based facilities for those living in rural communities.
So our patients can now see their specialists via telehealth visits without physically traveling over 100 miles to the urban and tertiary center. We can help with collaboration with the urban organizations as well to provide treatment and plans here in our community. So for example, Phelps Health has collaborated with Siteman Cancer Center to provide comprehensive cancer treatment. So our patients will have their evaluation and then be able to come back to their community and have their treatment and plans implemented here.
With a rich history of improving care for patients since 1949, Phelps Health, located in Rolla, Missouri, uses technology to educate and empower patients.
Phelps Health is a regional healthcare system in South Central Missouri. Over the years, we've grown and developed to meet the needs of the people in our 6-county service region. We currently have in our healthcare system a 240-bed hospital, as well as 100 providers in our medical group that service the needs of people in our region. Oftentimes in rural locations, hospitals and the healthcare system don't have the scope of services that are necessary to care for people that live there, and oftentimes they have to leave to different areas to receive the services they need. In our case, we have a broad and depth of services that allow us to care for people right here locally.
As one of Phelps Health's core values, investing in innovation provides high-quality care, increases patient safety, and improves the quality of life for individuals.
Here at Phelps Health, we're leveraging our current electronic medical record system to be able to offer telemedicine visits as well as a robust online patient portal for our patients. We also use streamlined audiovisual workstations to be able to offer consultation for patients for specialties that we don't have readily available, not only here in the hospital but also in the clinic. It means the world to a patient mother and her family whenever she's able to get evaluation by a specialized obstetrician right here at home. Our online portal not only offers the ability for patients to be able to review their charts real time, but it also enables them to have a two-way communication between the patient and their care team.
Rural hospitals such as Phelps Health have been the forefront of collaborative research between their clinician and physician and the scientists at universities. In our case, the collaboration between Phelps Health and S&T material scientists has resulted into innovative ideas such as treatment of liver cancer through glass science. Who would have thought that glass would actually come in helping really the cancer patients? As a result of that collaboration, there are 220 worldwide centers for treatment of liver cancer simply because of the innovative approach that Phelps Health has had in collaborating with Missouri S&T.
In the future, healthcare technology and research will continue to improve patient outcomes by providing improved access to the educational tools and best practices that are required to make informed decisions about their health.
A great example of collaboration between Phelps Health and Missouri S&T is OZARK Biomedical Initiative that started in 2016 and has resulted in significant collaborative efforts between Phelps Health physicians and clinicians and Missouri S&T faculty and research scientists. So the collaboration between clinicians and physicians and material scientists, engineers, and physical scientists has resulted in development of methods and technologies significant.